Norvasc belongs to a group of medicines called calcium channel blockers or calcium ion antagonists. They work by widening the blood vessels, making it easier for your heart to pump blood around the body and help increase the supply of blood and oxygen to your heart. Calcium channel blockers do not change the amount of calcium in your blood or bones. Indications. Norvasc is used to lower high blood pressure, hypertension, treat angina pectoris. Norvasc is not for the relief of a sudden attack of angina. How to use. Take Norvasc exactly as your doctor has prescribed. Follow directions given to you by a doctor or pharmacist carefully. The usual dose of Norvasc is 5 mg each day. Your doctor may increase this to 10 mg each day. Your doctor may prescribe to another dose of Norvasc depending on your condition and how you respond to this medicine. Swallow the tablets whole with a full glass of water. Take your medicine at about the same time each day, either morning or evening. Taking it at the same time each day will have the best effect. It will also help you remember when to take it. Norvasc can be taken with or without food. Contraindications. Don't take Norvasc if you have an allergy to Norvasc or any other medicine containing amlodipine. Other calcium channel blockers, such as medicines with active ingredient felodipine, nifedipine or lercanidipine. Warnings. Before taking Norvasc, tell doctor if you have congestive heart failure or liver disease. Drinking alcohol can feature lower blood pressure and may increase certain side effects of Norvasc. If you are being treated for high blood pressure, keep using Norvasc even if you feel well. High blood pressure often has no symptoms. You may need to use blood pressure medication for the rest of your life. Norvasc is only part of a complete program of treatments that may also include diet, exercise, weight control, and other medications. Follow your diet, medication, and exercise routines very closely. Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Get up slowly and steady yourself to prevent a fall. Norvasc side effects. Get emergency medical help if you have signs of an allergic reaction to Norvasc. Hives, difficulty breathing, swelling of your face, lips, tongue, or throat. In rare cases, when you first start taking Norvasc, your angina might get worse or you could have a heart attack. Seek emergency medical attention or call a doctor right away if you have symptoms such as chest pain or pressure, pain spreading to your jaw or shoulder, nausea, sweating. Call a doctor at once if you have pounding heartbeats or fluttering in your chest, worsening chest pain, swelling in your feet or ankles, severe drowsiness, or a lightheaded feeling like you might pass out. Common Norvasc side effects may include dizziness, drowsiness, feeling tight, stomach pain, nausea or flushing, warmth, redness or tingly feeling, swelling of your ankles and lower part of your legs.